Everybody, welcome back. My name is Dr. Amna Husain, board-certified pediatrician, board-certified lactation consultant, and mom. Today we're going to be talking about common breastfeeding myths, whether that come to actually nursing at the breast or if you're exclusively pumping and giving milk to your child. Now, I've heard a lot of these, not only just in the mom and parenting world, but also amongst lactation consultants and even amongst pediatricians. So I'm going to throw a couple of your way and we're going to debunk them together. All right, how about this first myth? We got to talk about it right out the door. If you don't breastfeed, you're not a good mom. False. False, 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 false. Formula is a life-saving invention. Moms might choose not to breastfeed for a number of reasons. That could be personal reasons, that could be medical reasons, whatever they may choose to, or maybe they're unable to. And a mother shouldn't feel shamed or guilted into doing something that she's not comfortable with. If you've ever heard me speak before on any of my social media platforms, Instagram or TikTok, you might hear me mention that breastfeeding is a relationship, first and foremost, between a mother and the baby. And that relationship can go on for as long as either party wants it to. So this is not something that you have to feel guilted into. You can still be a wonderful mother, even if you were to bottle feed breast milk or bottle feed formula, whatever you choose. Both babies can be healthy and thriving and loved. Myth 2. If you don't breastfeed your baby right away, you're unable to ever really induce lactation again. First of all, I want to mention that it's definitely easier if you're able to breastfeed early, immediately postpartum. I do talk about this in my video about setting yourself up for success with breastfeeding, which I'll link here. But that being said, there could be a number of reasons why you're unable to breastfeed in the first few days of life. Maybe you were not feeling well. Or maybe you wanted to initially feed formula, for example, and now you would like to induce lactation. Now, there's a few different ways to do this. We definitely recommend making sure that you're bringing baby to breast, right? Because breasts have to get the signal to produce enough milk. Second thing that can really help a lot is having a lot of skin-to-skin time with your baby. Now, a lot of these are super helpful in the immediate first few weeks to months after baby is born. But what if you were inducing lactation after a couple of months? Well, I highly recommend that you go to a physician and a lactation consultant, because the lactation consultant will not only help you with things like latch and being able to stimulate your breasts appropriately, but sometimes you might need prescription medications to actually induce lactation. And that's where a physician can really come into play and be able to not only just prescribe these medications, but also monitor you while you're on the medicines. Myth 3. If you eat gassy foods, your baby's gonna be gassy. Not true. Listen, if you eat broccoli or cabbage or onions, your broccoli can't jump from your mouth to your breast milk or jump from your stomach to your breast milk. That's just not the way it works. Broccoli is broken down in multiple ways in our small and large intestine, and then nutrients are circulated through mom's bloodstream. Thereafter, breast milk is produced. Does that make sense? So really, it can't jump from your stomach into your breast milk. Now, that being said, some moms definitely do see a big difference when they eat something and how their baby reacts. I'm not going to pretend that that doesn't exist. Certainly, if you feel like you are seeing some changes in your baby related to your diet, my biggest tip is please keep a food diary. Don't just start willy-nilly removing foods out of your diet or listening to what your friend says. Please talk to your medical professionals before you start removing foods from your diet, because as a nursing mother, we need to make sure that you're hitting appropriate nutrients as well. That being said, there are a few foods that do cross into breast milk. Namely, if I was really worried about an infant having some colicky issues, or perhaps having some intolerance, or having especially even blood in the stool, something that we can see in the newborn period, often due to cow's milk protein, then what I recommend is moms actually cutting out dairy. And at least giving yourself 2 weeks without dairy. Sometimes when we see young infants with eczema, moms can cut out eggs. Get it? Like eggs, eczema? Okay, totally different word, but I think it's funny. It's one of those like dad jokes. Well, I guess in this case, like a pediatrician joke. But I would highly recommend looping in your pediatrician so that they can guide you on what foods to potentially eliminate, if you even should eliminate a food. All right. The next myth. What mom eats is definitely going to affect the quality of her baby's breast milk. Not exactly true. Certainly, You want mom to be able to take in enough calories and hydration so that she's keeping herself nourished. But actually, milk quality is usually sufficient enough to support infant growth and development, even when mom's dietary supply of nutrients and energy might be limited. The only time you might see that actually change is if it's chronically limited or depleted. So you might want to think about this in low socioeconomic status or developing nations where there's a chronic stress on the parent. And that doesn't even just apply to nutritional intake and caloric intake, but also even emotional and psychological stressors that can definitely impact milk quality for the baby. But in general, what I'm trying to say is if a mom chose to potentially decrease certain high-fat foods out of her diet, that's not going to necessarily ruin your milk quality. This is really important when it comes to old wives' tales where maybe a grandma or somebody elderly in the family is recommending mom put lots of butter in her food because the more calories she takes in, the richer her breast milk is going to be. Nope, that's a myth. That being said, the type of fat the mom consumes does have an effect on the composition of milk. For example, mom's ingestion of long-chain fatty acids can be very helpful in breast milk because we want those omega-3 fatty acids for baby's development of their brain and their eyesight. What about this myth? Women with small breasts will not produce enough milk or may not produce as much milk as women with larger breasts. That's a myth. So actually, the functional tissue, or the tissue that is actually responsible for producing breast milk, grows in response to what your baby's needs will be. The breast tissue you need to nurse a baby is actually going to grow in response to pregnancy regardless of a woman's breast size. It's the so-called functional tissue rather than fatty tissue that is actually responsible for where the milk ducts are located and for producing that milk for baby. So whether you're an A cup or a D cup, your breasts can definitely be responsible for producing enough milk for your baby. If you've had a breast reduction or a breast augmentation, you won't be able to breastfeed, or you might have difficulty breastfeeding. Actually, this is a myth, and it's becoming less of an issue now as more women are being upfront and open with their plastic surgeons about their concerns and what they desire for breastfeeding in the future. More plastic surgeons are actually becoming more cognizant of this as well. So your plastic surgeon might ask you these questions, or you might freely offer that you would like to breastfeed your baby in the future. Let your surgeon know, because there's definitely incisions that can be done that we can actually preserve some of the milk ducts and actually help prevent severing of too many of the nerves near the nipple. That way you can still have a good milk letdown. So you can still have a successful breastfeeding journey even if you had a breast augmentation or a reduction. It just requires you to be very open and communicate that with your surgeon. All right, what about this myth? Exercise is going to turn your milk sour and then baby won't want to drink. That's a myth. Definitely with exercise, you can produce lactic acid, but that lactic acid shouldn't really change the way your breast milk tastes. Recent studies have shown that babies might not even notice a difference. However, if you are sweating, your sweat can have a salty taste to it. So if, for example, there's sweat on your nipple or on your breast tissue and your baby obviously has a great latch and takes a good bit of the breast tissue in their mouth when they're drinking, that could turn them off a little bit. So if you want to, rinse your breasts right after you exercise or just take a quick shower before you sit down to nurse your baby, and it shouldn't be an issue. That being said, no, you don't always have to rinse your nipples before you feed your baby. That's another myth that I've heard. It's not necessary. You don't have to rinse your nipples. You don't have to prepare your nipples before you start your breastfeeding journey. Common myth, and that's completely untrue. Huge myth. If you drink alcohol, you have to pump and dump. Not necessarily, actually. You just need to be smart about what time you time your drink. Typically, I tell parents that it should just be one drink, for example, and try to do it right after you feed the baby. So let's say you're feeding baby every 3 hours. Well, then right after you feed your baby, you can go ahead and plan time to have a drink. Now, that could be 1 glass of wine or small amounts of hard liquor. You don't necessarily have to pump and dump, especially because if the next feeding is again going to be in about 2.5 to 3 hours, by that point, the alcohol should have left your bloodstream and not had a chance to really be in your breast milk as well. Now, if you're going to have more than that, make sure you potentially pump a bottle beforehand so that baby will be able to feed from breast milk that doesn't have high alcohol contents in it. But again, if you're drinking in moderation, for example, 1 glass of wine, you don't need to pump and dump. You just need to time your drink wisely. If you're taking medications, you can't breastfeed. So this myth is not really true, especially with certain medications that carry a bad taboo label. For example, antidepressants. Postpartum can be a difficult time for many women, and if they choose to seek help, and that help also includes being on an antidepressant, then absolutely they should be upfront with their doctor and let them know that they're breastfeeding. And actually, many qualified perinatal mental health specialists are very well accustomed to which antidepressants are safe for nursing moms. At the end of the day, I had mentioned breastfeeding is a relationship, and you want mom to be in a healthy place in that relationship, mentally, physically, and emotionally. With other medications, perhaps some cold or allergy medications and decongestants, it might be helpful to ask your pediatrician or ask your OBGYN if they're safe to take while breastfeeding, because some of those medications can have an adverse effect on your milk supply. So there might be other medicines that you can take for your symptoms that would be safer and help preserve your milk supply. But in general, I'm finding that a lot of doctors, for example, or a lot of healthcare professionals might on the safer end just say, oh, you should just pump or dump. But honestly, a lot of medicines are pretty safe, and you just have to be very cognizant and speak to your provider upfront about the fact that you're breastfeeding, and is it really necessary for you to dump your breast milk? You can't get pregnant if you're breastfeeding. Nope, that's a myth. If you're having sex, you can get pregnant. Certainly, you're less likely to potentially get pregnant if you're within the first 6 months, your period hasn't returned, and your baby is feeding basically every 2 to 3 hours, even overnight. That being said, I think it's really important for women to stick with that 6-week checkup with their OBGYN so you can discuss contraception methods, especially because lactation amenorrhea is not really a dependable birth control method. You shouldn't nurse if you have a clogged duct. Actually, it's the opposite. You should be nursing as frequently as possible so you can help relieve that clogged duct and that pressure. In fact, clogged ducts often form because milk is inadequately being emptied from the breast. Besides frequent nursing, applying heat, whether you do a warm washcloth or a heating pad, all of those things can help as well. But definitely, I encourage you to bring your baby to the breast. You can even try nursing in different positions so you can help try to relieve that clogged duct. Mothers shouldn't nurse if they're sick. Actually, it can be really beneficial if moms are able to nurse when they're feeling ill. They can actually pass those antibodies that their body is producing while fighting an infection onto the baby. That being said, there is a caveat. If you are feeling ill enough to the point that you physically are having body aches or chills, or you just don't feel up to nursing your infant, don't force yourself to do something that might be an unsafe position for you or your baby. If you're not feeling well, then take that time for yourself, even if it's a day, so you can rest and recuperate, and then maybe you'll be ready the next day to feed your baby. But in general, it is totally fine for a mom to breastfeed her infant while she's feeling ill. We even do this for women who've had COVID. You can absolutely put a mask on and still nurse your infant at the breast, or pump and give pumped milk to your baby. Again, the only caveat would be if you physically do not feel well enough to actually be able to pick up your baby and hold them or nurse them for a longer period of time, then in that case, you really have to give your body time to recuperate. That being said, there are some illnesses that if baby is too close to the mother or does take in breast milk while mother is acutely ill, it can be dangerous for the baby. For example, HIV or varicella or chickenpox. In the immediate days, sort of if a mother is feeling ill and has chickenpox, those are situations where it'd probably be better if baby is not nursing at the breast. And in certain situations, it's actually a risks versus benefits situation where it's okay for a baby to drink milk from a mom who is HIV positive. But again, those are very specific situations where your doctor is better able to guide you with even the input of an infectious disease doctor potentially. What about this one? Babies have to be weaned by their first birthday. This is more of a sort of cultural common thing that we see. But in general, there's absolutely no deadline or guidelines out there about when a child should be weaned by. Breastfeeding, again, is a relationship that can go on for as long as either party in that relationship wants it to. Now, if at 12 months of age you are ready to wean your child, then that's totally fine. Even if you wanted to wean your child before that, you can do that. You're a member of this relationship and you have to make the best choice for yourself. And if your child wants to wean, let's say before 12 months, or potentially might want to wean a little bit after 12 months, and you feel comfortable with that, that's okay. But you don't have to fall prey to societal pressures and feel like you have to stop at a certain time. Infants can still benefit from extended breastfeeding times. You can have good time with bonding with your infant. Yes, you're still getting some transfer of antibodies, but this is definitely something that's a personal decision and isn't something that should be weighed on by really the cultural norms or what people should expect. Well, guys, that's all I have for you. I hope this was really helpful. These are common myths that I encounter a lot, and definitely we didn't even touch on COVID and breastfeeding. But absolutely, if you have any questions below, make sure you leave them down in the comments. If this video was helpful, give it a thumbs up, subscribe, and let me know if you have any other suggestions for future videos, and make sure you tune in next Monday for the next video.